Skokie is a unique community. It's right on the edge of the city of Chicago. People that live in Chicago have the benefit of a lot of treatment options. There's a lot of programs here that treat mental health conditions. The difference at Rogers is that we have a very strong focus on cognitive behavioral therapy, and we use highly evidence-based treatment protocols. The other main difference at Rogers, programs all involve individual cognitive behavioral therapy protocols.
And that part of the individual time, which isn't all individual, therapy, that's time for people to work on their own goals, that fosters independence so that when somebody steps down from Rogers, they're in a position where they already know how to start to do those things to help themselves. And I think that's a thing that you get here that you wouldn't get in other programs in the area.
We also work as a team so well. So operations is working very closely with the clinical team. Every one of our patients has a psychiatrist assigned in which the psychiatrist is meeting with the patients. There's also a psychologist who's overseeing and supervising the clinicians. There's a therapist. On the child side, there's a family therapist who's really coordinating with outpatient therapy and with the family doing family education, family sessions. We have nursing here on staff, full-time nurses. We have a dietitian. So we really utilize all of our clinicians, all of our professional staff, all of our clinical staff to provide the best care that we can.
As a psychiatrist, I'm part of a multidisciplinary team. It allows us to collaborate with other team members, get their input on how things are going for a patient. So having that extra information allows me to better clinically assess what exactly is going on with the patient and to manage that situation more appropriately.
And then the great thing is that just makes so much energy here. This place is abuzz with positive energy. Another aspect that we have included in our treatment programming is the incorporation of family members and loved ones.
We're able to provide resources, better understanding, and a community for the guardians, the families, the caretakers, even the educators. And I think that really makes a world of difference for an individual coming to our program.
Because what we know and what we see is that when we can empower a family with these tools, then it's going to stick. And what we can do is really pull the strengths that have already been very much a part of a family, very much part of a system, very much part of a child, and increase those strengths while adding in some new strategies so that the things that are maybe more difficult aren't so overwhelming.
Because they do outcome studies, we're able to actually measure the improvement and the clinical progress that a patient is making. There's a lot of programs out there that say they can get results, but Rogers actually backs it up with evidence and with the data. And I think that is something that is very unique about Rogers.
It all comes down to the fact that we care. We care for our patients, we care for our families, we care for them in many arenas of their lives to really help them to live a life that's more fulfilling.